Of course, we're once again delighted to be joined by Dr. Manfred Green, Director of the University of Haifa's International Master's Program in Public Health and Global Health Leadership. As the world, and in particular in Israel, attempts to open back up, Dr. Green will discuss where we go from here and what we should keep in mind as we attempt to reintegrate. As always, for more information on the university's response and briefings around the pandemic, and to support the university during this time, please find a link included within this post. To you, Dr. Green.
Thanks very much, James, and hi, everybody. As James said, we'll talk more freely this time. I'll talk more freely and look at some of the things. So, as we usually do, just a quick overview that the cases are increasing. Actually, the percentages, they are not quite correct. I needed to adjust them, but we're now approaching 5 million cases in the world, which is just the reported, and you can multiply that by a factor of maybe 10 to 20 of what actually has happened. And we've got to nearly 300,000 reported deaths, or just over. So let me tell you what's happening in Israel right now. Interestingly enough, today, it was the first day that no case has been reported. So in fact, in Israel, we have actually had no reported case today. Of course, I spoke to a colleague of mine, a physician, who said, you see, the virus now has left Israel. It's no longer here. Well, that's a little optimistic. The fact that we don't actually have any reported cases doesn't mean the virus is gone. The other is, of course, that we're still part of the global society. And as they say, an epidemic there is going to be an epidemic here. And so we're still exposed to whatever will be coming in later. So at the moment, though, there's very little action in this country. And then, of course, what the major question now is what's next? We've got this lockdown. It's being relaxed gradually. And the question is, how do we deal with it? How do we actually, are we going to be able to work out a way where we live with the virus and continue basically to do what we should be doing day to day, and yet not yet have a vaccine or something that's really going to be much more towards a solution. I remind you that without a vaccine, we've never actually eradicated a virus. Viruses have very occasionally disappeared. Those are the ones usually that were really not very effective in establishing themselves in humans, those that came from animals. And the only one that was really eradicated was smallpox, and that was a major international campaign, and that was with a vaccine. So what is the old norm? I mean, it's not so old, but it actually, if we talk pre-COVID-19 and post, we usually had got used to the idea that communicable diseases are now largely mild or controllable with vaccines and antibiotics and antiviral drugs, and that they're not really a major problem. There are obviously still HIV, hepatitis C, many that are, but it was almost a situation where you could feel that you more or less could protect yourself from most of the serious communicable diseases. And that the big problem was chronic diseases like heart disease and cancer and stroke and so on, and that those were regarded as the major causes of death. And that's actually, we kind of lived with that there was a process where you knew that at some stage you would reach a very old age, hopefully, and then succumb to one of the chronic diseases. So the new norm now is basically, and we don't know how long it'll last, but that not all communicable diseases are mild or easily controlled. And that COVID-19 could become one of the leading causes of death, but I stress in the elderly, and usually with underlying conditions. So it's not necessarily going to be something that you will fear all your life. It will be one of those possibilities that could occur late in life. Not that you can't get sick from it, but it would be a cause of death usually late in life. This is the pattern that we're seeing now, although we are seeing complications in younger people. So it's not as simple as it sounds. But basically, we really, at this time, we really have to see how we can live with risk, because we need basically to get back to living life as we should, and to get the economy going, and so people go to school and wherever and work and so on and so forth. So let's just look at some of the issues that you face when you're living with risk. First of all, what are the sources of risk, voluntary and involuntary? And that's often said in that way because if somebody imposes a risk on you, you very much object to it, like environmental pollution or somebody putting up, something in your area that's creating noise and so on. So those kind of things you really, but a voluntary risk is somehow more acceptable, like climbing a mountain. That's your choice, sort of. But here, if you take a situation where this risk is actually involuntary, you're still going to live with it, but in a sense, you probably have to reach a situation where you're not going to be blaming somebody for it, because if it's involuntary and you think somebody else is causing it, then obviously that becomes a risk that's much more difficult to deal with from a psychological point of view, from your own. And then there's this objective and perceived risk. Is the risk as great as it really is? How do we communicate it? How do we manage it? And then, of course, this whole question of what are the cost benefits of risk reduction and avoidance? And then there are the ethical issues. So what we're really facing now is this cost benefit of risk reduction and avoidance, while we should remember the other factors, because in order to deal with it, we need actually to remember that we need to communicate it, we need to manage it, we need to distinguish between objective and perceived risk. And the cost benefit basically now is going to be how much are we prepared to pay to actually reduce the risk in a segment of the population, and we can define it in different ways, older age, underlying conditions and whatever. And the cost may be substantial, in fact, very substantial. So we're starting to see now a discourse more and more, particularly in the countries that seen a reduction, but mainly because we, in a sense, we've got used to having COVID around, COVID-19. We almost become accustomed to seeing data on deaths and cases and masks and so on. But it's kind of, in a sense, you become almost immune, and not in the sense of antibodies, but you psychologically immune, and you kind of believe, well, this is something we need to get used to, so we're going to get on with it. So now this is basically what I think you're seeing in many places. Let's just get on with our lives, and what will be, will be. And this, of course, is a situation which is obviously going to create issues. So what is happening particularly now is that people are saying, well, it looks like it's gone down to a very low level, so maybe it's gone away. Let's just go back and do whatever we want. And of course, there may be this increase either in the next couple of months or in the winter, which is a likely, fall, winter, which is a likely possibility. So unless we get bumped again with something that's extremely new, in other words, the actual increase is substantial, and therefore it looks frightening, we may just get used to these little ups and downs. So that's possibly what will be happening, is that we need to maintain it at a level where we don't get to this very dramatic increase. I just wanted to mention something else that about the voluntary. I'm not sure that this example fits in well here, but I thought of it just while I was working on this. For cancer, most people who you talk about cancer, most people will believe that there is always a cause, and you need to find the cause. Either it's smoking or bad habits and so on. But there is a concept, what's called the bad luck hypothesis. And this was actually a paper written some years ago in Science, where they suggested that about 2/3 of the cancers were simply replication errors in the DNA. In other words, it had nothing to do with anything you did or you were exposed to. And they called this, they said that the majority of cancers are due to these random mutations, although this has been modified, I must add, and that's certainly not the majority, but some of them. And that has been called the bad luck hypothesis, that cancer may largely be the result of bad luck and not punishment for adverse behaviors and exposure. So in a sense, what you do is you get in a situation where you can actually deal with the situation and say, I can't really do much about it, and if I do get it, it'll be bad luck. So will it be a matter of bad luck to die from COVID-19, which sometimes is not really a bad approach, because then in a sense you become you resolve that you actually resolve this conflict where you can't do anything to it. So the most likely scenario in the near future is that we're going to go back to normal living, and we're going to accept that there is an increase of risk of serious illness in the elderly from COVID-19, until, of course, there's a vaccine, and then that may certainly change the scene, and we hope that'll be. So how easy is it going to be to do that? Well, first of all, the few things I mentioned, and I'll stress them as the last few points. You have to make sure that people will feel that anyone who is ill with COVID-19 gets very good care. And that should reduce the case fatality rate so it becomes less of a frightening disease, and also a disease which you feel, in any event, if I get it, I have a good chance I'm going to get out of it. And certainly that's true in any event for 95 or 97% of the population, or maybe more. It's only a very small percent who actually die from the disease. So we need to invest heavily in infrastructure of the health system to cope with this, invest in research so that we improve the treatment, and keep looking for a gap. And this last point is the very one that I really want to stress more than anything else. I think what happens is whenever we see this kind of situation where we go into this kind of almost panic mode and stress mode, and we get ready and we do everything that we should do, we actually then get to a situation where, okay, we've done everything, we've got over this crisis, so let's ignore it and get on with our lives and forget that we really need to now prepare for the future pandemic. So now is the time really to start thinking how we can actually prepare for the future pandemics without necessarily just blaming whatever was done before, and talking about the things that we've learned from this and really get on with it. Thanks very much.